So, how can we discuss as doctors, providers, and patients the mind body connection when it comes to health without making patients feel as if we're saying it's all in their head and without making providers feel that we can't address the main issue and we just have to keep prescribing medications or do unnecessary tests? I'm Dr. Tracy Tyson. I'm a board certified general pediatrician, and this is something that means a lot to me. It really upsets me and makes me feel very defeated when families and patients leave feeling as if we just felt like it was all in their head, that their symptoms are not real, because that's not actually what we mean in medicine, most of us, when we are saying we think this could have a mental health component. There are so many studies that show that the mind-body connection is so much more powerful than even we realize as of now, and that there's so many physical symptoms that are either made worse by or completely caused by poor mental health, as well as poor sleep, poor nutrition, poor exercise, stress. All of these things can make us have physical symptoms when we don't listen to our mental health. This is not to say that there isn't both, right? If you have a severe vitamin deficiency, it's going to make you very anxious. And so it does require give and take from both parties, being open, being honest, being willing to keep pushing forward and staying in constant contact with each other. So if you are a patient who is struggling with some complex physical symptoms and you keep feeling as if your mental health is being blamed for them, I want you to take a moment, write down a lot of your thoughts and feelings, what your symptoms are, what is going on, and come in with some written objectives for your provider, because it really helps us break things down and ask us those detailed questions. And as providers, we want for you to understand that we do want to get to the root cause of the problem. We don't want to just write you for a bunch of medications, but if we can't deal with the lifestyle, the stress, the mental health, we are going to end up having to treat your physical symptoms, which is not good, and we don't want to do that. So I know this is a complex issue. We definitely in Western medicine need to be much better about this and expressing exactly what it is that we mean. I'll give you a few examples. There is a lot of evidence to suggest that individuals who have migraines have much worse headaches when their mental health is poor, when they're stressed, when they don't have enough sleep. Those migraines are migraines. However, the person will notice significant increase in them when they are not managing their mental health. So the best thing to do in that case is not to give more medications for migraines. It's to actually manage the other parts of the life. Now, when that is not possible, because it's not possible for everybody, they may not be able to, there may be resources, access issues, inability. There's so many different factors. And so, yes, sometimes medications are used when we know something else could be more helpful. Another issue is like a tic disorder in a child, where a child has a motor tic where they do something unintended. Those are sometimes much worse in children who are stressed. Tics are not caused by stress in most cases, but they're going to be much worse when that's the case. If someone has asthma and their mental health is poor, they may have more chest pain, and it's hard to tell what's the difference between their asthma and their chest pain. Again, none of this is saying that people are making it up. We really, truly do not believe that. We just know how strong that mind-body connection is, but we don't have a great test to say one versus the other. So let's do a little bit better. You guys help us out as patients and parents, and we will try our best to try to explain this a little bit better. But we all really do want to get to the root cause of these issues, and we know how much lifestyle, stress, poor mental health can affect our physical health, and vice versa. If you're chronically sick, you're going to have poor mental health. So when your doctor recommends something like an anxiety medication or therapy, and you take offense to that, please know how we mean it is that if we had to feel like you did every day, we would also need therapy. And sometimes an SSRI or anxiety and depression medication can help the person get through, even if that's not the cause of the symptom. So if you have any questions or just comments about things that you wish that your provider knew, as someone who struggles with chronic issues that often get blamed on mental health or both of them are connected, please let me know.